About the future of Medicare. We've got a new administration coming in, a new CMS director, Dr. Oz, the Center for Medicare and Medicaid Services. And there are some proposals floating around out there supported by Dr. Oz and the new director of Office of Management and Budget, the Republican Study Committee, and Heritage Foundation. And I'm going to talk about that today and how it's going to affect your Medicare Advantage plan, how it might affect your Medicare, how it might affect your Medicare supplement. And we'll get into all that today. It should take about 10 or 15 minutes. And then, as usual, I'm going to open it up to the floor for all things question and answer. And let me try my volume here. I spoke for 9 minutes yesterday, and I guess I didn't have any volume, and hopefully I've got it today. But I have kids, so I'm used to talking for hours and hours and nobody listening to me. So I guess that's par for the course when you have kids, right? All right, so let's go ahead and get into it. If you're new to my channel, my name is Ed Weir. I ran the third busiest Social Security office in the country, and my new mission in semi-retirement is to make sure you get everything you're entitled to from all things Social Security, retirement benefits, spouse benefits, survivor benefits, all the rest of it. All right, so let's go ahead and jump into it. And so what we're looking at is what's called essentially a push to make Medicare Advantage the default choice. So you can read this in Dr. Oz's policies. He was always been a big advocate of Medicare Advantage. The next OMB director is a big advocate. So there's certain things that obviously the entire Medicare system, the entire healthcare system in the United States, particularly in terms of insurance, we've got the best healthcare system in the world, but access to that is definitely wanting. So there are plans that are coming to the top right now about making Medicare Advantage the default choice. So how would that affect your particular Medicare Advantage, your Medicare supplement, and all the rest of it? So basically, people going forward, I pulled this right out of the quote, automatically enrolls Medicare beneficiaries in the lowest cost plan in a given region. This is similar to what happens with a Medicare prescription drug Part D now. If you have Medicaid, they pretty much just pick a Part D plan, kind of the cheapest one in your particular area. But with the Medicare Advantage, I'm not sure how that's going to happen because a lot of those plans are zero premium per month. So quite a few of them, most of them are zero premium. So they're all lowest cost. So I'm not exactly sure how they're going to pick what particular company you have going forward. But they're talking about instead of you going perhaps to Social Security and signing up for Part A and Part B, and then going out into the open market and looking for a Medicare supplement plan or a Medicare Advantage plan, they will just automatically default and just sign you up one willy nilly. And the idea is that's you can change it. That's the initial type of situation that you can change it. Whether that's going to be the same in the future, we don't know. These are proposals going out, and anytime I do these proposals, someone types in the comments, "Well, you don't know what's going to happen, so why are you talking about it?" Well, if that kind of philosophy, this is probably not the channel for you because if you're waiting around on your hands for the political overlords to make the decisions for us, and then I'll tell you what happens, and you just have to follow like sheep. That's probably not the channel. This is not the channel for you. My job again is to make sure you're receiving everything you're entitled to, you, your family. And my next mission and my semi-retirement is to make sure all of these benefits that you earned are here in the future, including the retirement, survivor benefits, Medicare, and all the rest of it. So this is your kind of call to action. If you think Medicare Advantage should be the default and everybody should have a Medicare Advantage, mandatory or voluntary or whatever the case may be, then call your politicians and say, yes, Medicare Advantage is awesome. We want that to be the default option, and we are good with it. If you do not, now is definitely the time to contact your politicians and say no. Or there's a middle road. So the big issues with Medicare Advantage, why people don't like the Medicare Advantage plans, are the networks and the pre-authorizations. Like for instance, next year, 2025 is probably the most tumultuous Medicare season we've had in decades. Medicare Advantage and the Part D plans have changed substantially for next year. There's close to 2 million people that have had their Medicare Advantage plans canceled. There are millions more that have had their plans downgraded, and Medicare insurance companies know that 70% of people don't check their Medicare plans. So they can do pretty much whatever they want because those plans are only good for 1 year. So they change the stuff under the hood, kind of the fine print type stuff, which a lot of people don't, can't understand because it's in bureaucratic language and they don't know until something happens, until next year in January, February, March. You go to the doctor and they hand you a bill, whatever the case may be. So that's why I partnered up with Chapter Medicare. So if you need help reviewing your plan, make sure you reach out to them or your insurance agent or broker, whoever you have helping you. Make sure you review your plan. If you don't have anybody, call a chapter there and they'll help you out. So President-elect Trump has been talking about for a long time. He talked about in his previous administration that he's got a beautiful plan and he was going to come out with it next week and the next week and the next week. And now he has concepts of a beautiful plan, but we haven't seen anything yet. But it's telling that he has picked people like Dr. Oz for the head of all this, a person who believes in Medicare Advantage for all. That's his statement. He wants Medicare Advantage for all rather than, universal health care, Medicare Advantage for all, and possibly maybe bringing that down to people under 65. So maybe getting rid of Obamacare, because there's three kind of possible options for universal health care. It's kind of taking the Obamacare and making it for everybody. I don't see that happening because it has the name Obama in it. There's another option is just go ahead and keep in Medicare and Medicare supplements. Those are the ones I prefer. If you're currently about to sign up for Medicare, I recommend Medicare supplements, the Plan N or Plan G. If it's not for you because of a budget issue or something, then Medicare Advantage, you just have to, keep up on those a little bit better. Or the other option is to kind of make Medicare Advantage a universal plan. A fourth option would be completely redesign a brand new health insurance system in the United States, but that's going to take way, way too long. And because President-elect Trump may only have 2 years to do this, because next time in the House of Representatives and mid-year elections, they might lose the House. So if anything's going to be done, it's got to be done immediately, if not sooner. So Obamacare, no. Medicare supplements, the health insurance companies just don't make enough money on Medicare supplements, so they're not going to want that. Medicare health insurance companies make a lot of money on Medicare Advantage, so that's probably the one they're going to push, and that's the one Dr. Oz recommends. Going forward, if possibly what happens is you don't sign up for Medicare, you just go ahead and sign up for Medicare Advantage. If you currently have a Medicare Advantage, it might be good, it might be bad. Those two issues, the prior authorizations and the networks, really need to be addressed. If these become kind of a monopolistic system where there's a handful of Medicare insurance companies that control the entire pie, then that might be the end of zero premium per month. The zero premium per month has only happened, within the last few years. When the Medicare Advantage plans first came out, there was a monthly premium. They went to the zero to get more people to sign up. And now that they've got the baby boomers pretty much signed up, about 51% of people take Medicare Advantage. Now they've got them signed up, they might go back to start charging a premium once they essentially get this monopolistic system set up. What if you have a Medicare supplement plan already? Well, most of these Medicare supplement plans that you have, those companies, almost all, also have Medicare Advantage plans. And if you have a Medicare supplement plan, you've probably received mail or phone calls from that particular company saying, hey, we've got a great plan. It's got dental and vision and hearing and, extra, unicorns and free ice cream and stuff. Why don't you switch over to that? And they're trying to convince you to switch over to a Medicare Advantage plan because they make more money on a Medicare Advantage plan. So that might cause issues with Medicare supplements in the future. They won't be able to necessarily just cancel your Medicare supplement plan unless they change the laws, but they can certainly kind of price you out of the market if you don't have an initial pricing. With Medicare supplement plans, there's three different pricing methods. One of them is basically your initial, but they can still, increase prices year over year. So they might, kind of price you out where you have to switch to a Medicare Advantage. If Medicare Advantage takes over, that could definitely be a possibility. Why the big issue on this is because the Medicare Trust Fund, Part A, looks to be depleted in 2036. Starting in 2030, we're going to spend more than the revenue brings in because, FICA tax, your FICA tax pays for Social Security, and then 1.45% goes for Medicare. And then your employer pays the other 1.45. So there's a trust fund. The trust fund is good for about 6 years. And then the trust fund fund runs out. Just like Social Security Trust Fund, there's $2.6 trillion in the Social Security Trust Fund, and that looks to be running out about 2034. If some policies take effect, it'll be 2031, and we're looking at it probably 21 to 33% cut in your Social Security check. I've talked about that several times before. So you essentially, here's your choices. You either wait or decide what they're going to do with our health care, or you reach out and voice your opinion and say, well, no, Medicare Advantage is awesome. It's not awesome. I want this, and we should think about this. So now is the time to get involved, participatory bureaucracy, rather than waiting for our political overlords to make our decisions for us.